The biggest limiting factor to a side plank is shoulder pain. So in this video, I want to share my 4 tips on how to side plank without shoulder pain. So let's start off with what is a side plank. It sounds like an easy question, but if a side plank to you is dropping down on your side and lifting up, either holding or going up and down, and that's it, then that's not a side plank. That's typically how we encounter shoulder pain. There are specific things we need to execute when it comes to our setup of a side plank to make sure that we don't have shoulder pain. Why? Because 9 times out of 10, people stop because of the shoulder pain, not necessarily because their abs are telling them to. So let's jump down and go through the 4 strategies so you don't have shoulder pain the next time you side plank. Tip number 1, scapular depression. When we're in this position, we need to think, can we get that scapula to go down to start to engage the lower trap? Why? We want to start to recruit other muscles so that we don't have anterior shoulder pain. So an easy way to do this is to start in a really poor position where your shoulder is pretty close to your ear, and all you're going to do is press away, aka scapular depression, so that way you are trying to increase the amount of space between your shoulder and your ear. Then, as we go through our plank, we need to maintain this overall position. Tip number 2, scapular retraction. Now that we have the depression, we need to actually retract the scapula. Now, sometimes people actually do this, but they get the motion through the wrong place. So instead of this isolated scapular retraction, they actually rotate the whole thoracic spine. So what you want to think about when you do this is when you go to retract, if you have a logo like I do on my shirt, the Under Armour logo, when I go to retract, that doesn't turn. The Under Armour logo or the logo on your shirt should stay facing horizontal or wherever it's starting when you add that retraction in. Number 2, when you actually retract the scapula, you should feel the scapular muscles engage. So take a second, go through that scapular retraction and ask yourself, 1, did the logo on my shirt move? And 2, do I feel my scapular muscles engaged? Tip number 3, avoid moving positions. Now that we have scapular depression and scapular retraction, when we start to lift up, a lot of times people don't stay over or stay heavy over the shoulder. What they do is they abduct and move away. The problem with this is that this is a biomechanically a much more vulnerable position for the shoulder because we're not stacked on top of it. So you really have to stay conscious when you start to lift up. Are you lifting straight up and engaging the scapular muscles and staying heavy, or are you lifting straight up and disengaging and moving away? So really be conscious of this as you start to prepare to lift up. Tip number 4, move slowly. Now we have our scapular depression, our retraction, we're aware of not moving away or abducting the arm. When we go to lift, I see it all the time, people just lift up. The problem with just lifting up is it's such a fast movement that it pretty much gives fair game to anything it wants to start to help. So we see a lot of necks kick in, we see the legs overworking, we see low back starting to work. So what we need to do to make sure we don't start having this discomfort is we need to move slowly. You can reword the cue and really try to follow it to help yourself move slowly. Here's what I like to do. Instead of just saying lift up, cue lift the rib cage until your hips come off the ground. So the rib cage is staying high. When we do that, we're cueing A, the abs to turn on before we actually move, and B, we're maintaining the ab contraction throughout its entirety. So we're moving slowly. We are resisting the urge to just pop the hips up. When we can do this, we're gonna get a lot more abdominal contraction, and as we get more abdominal contraction, that's way less likely to start to aggravate the shoulder. So those are my 4 tips to helping decrease the likelihood of shoulder pain. As I mentioned in the beginning, it's all in the setup. Yes, it will take a little bit more time as you start to learn it, but over time, you'll start to be able to kick it in and understand right versus wrong and learn if you need to make subtle changes. But for the time being, as you're learning this, really take your time, go through those steps, make sure that you can get your shoulder blade depressed, your shoulder blade retracted, avoid abducting the arm, and lastly, move slowly.